Zacharowski, who's a very good friend of mine and our last presenter of the day. Kai has the position of the ordinarius and the director of the Department of Anesthesiology and Intensive Care Medicine at the University of Hospital in Frankfurt in Germany, and he's been there since 2009. He has a vast research, teaching, and consulting interest, both in clinical and basic aspects of patient blood management, clotting, and big data in anesthesia and intensive care. He received his MD from the German University of Mainz and his PhD from Queen Mary University of London in the UK, where he was working with the Nobel laureate Professor Sir John Vane, who discovered how aspirin works. Since 2016, he's been one of the fewest members of the oldest Academy of Science in the world, the Leopoldina, and his scientific contributions are published in peer-reviewed journals such as Nature Medicine, The Lancet, New England Journal of Medicine, and the Proceedings of the National Academy of Science. And he's been awarded with numerous awards for innovative clinical research. He serves as the editor-in-chief for the Journal of Anesthesia and Intensive Care Medicine, and is an editorial board member of numerous journals such as Critical Care Medicine, Emergency Medicine, and Anesthesia. He's a chief executive officer of the Lowfert Foundation and the founder and CEO of the Patient Blood Management Program, which we've been hearing about today. Most recently, Kai is serving as the current president of the European Society of Anesthesiology and Intensive Care for the next 12 months. And he practices anesthesia and critical care medicine in Frankfurt. Kai is going to talk to us today about the latest data from the Aprotinin Patient Registry. It gives me great pleasure to hand over to Professor Zacharowski. Thank you.
Good afternoon. My name is Kai Zacharowski, and I'm the president of the European Society of Anesthesiology and Intensive Care. And it's a great pleasure today to talk about patient blood management in cardiac surgery. What is the place of aprotinin? And what you see here in the background on the slide is the helicopter path of the University Hospital in Frankfurt and the beautiful skyscrapers in Frankfurt. This is my conflict of interest slide, and you see there's a lot of conflict of interest for my department and myself, and there's so many that I do not have any more conflicts of interest. And everything what I tell you today is my personal opinion. Today I'm presenting you the latest data from the Aprotinin Patient Registry. It's a non-interventional post-authorization safety study, and this registry was conducted to monitor, obviously, the safety pattern of use of aprotinin. And this upper registry ended in agreement with a PRAC from the European Medical Agency. Initially, we planned a 3-year study and 12,000 patients. The PRAC, however, acknowledged that the analysis of 3,500 patients would answer the questions and the objectives of this registry. In total, we recorded 6,682 patients in this registry. And the last patient included was on the 31st of August in 2020, and the data lock-on was on the 31st of October, also in 2020. What were the aims of this registry? On one side, you see on the left side, the monitoring the pattern of use of aprotinin, and on the right side, minimizing the risk. So obviously, the number of patients treated with aprotinin, the indication on and off label, the patient characteristics and risk factors, and the conditions of use, including data on concomitant use of drugs that affect hemostasis, like oral anticoagulants, heparin, or other antiplatelet therapy. Minimizing risk, use of activated clotting time, heparinization, use of aprotinin with aminoglycosides, pregnancy and lactation, and maybe other adverse drug reactions. I think first I need to read to you again what is the current indication of aprotinin. It's a prophylactic use to reduce blood loss and blood transfusion in adult patients who are at high risk of major blood loss undergoing isolated cardiopulmonary bypass graft surgery. That is very important. We're talking about isolated cardiopulmonary bypass graft surgery. Everybody who has worked in the past with Aprotinin is always thinking about the more severe cases. But this is the indication of Aprotinin. And again, here's a sentence which is of importance. Aprotinin should only be used after careful consideration of the benefits and risks, and the consideration that alternative treatments are available. And here is the overall patient disposition depicted. You see 6,682 patients. Some patients had to be excluded because it was retrospective inclusion, or they underwent non-cardiac surgery. And as a valid population, 6,610 patients were viewed. 863 were children, so age under 15 years, and they were more or less all from the UK. 3 children were from Belgium, and the majority over 15 years were adults, 5,747 patients. And then another 198 dropped out because the patients were refused the data entry. And overall, 6,412 entered into the database. And then you can look here at the bottom. We had some more exclusions. However, 6,247 patients were included and helped us to do the following calculations. And here you see the distribution of treated patients across countries. And you see in the UK, 2,865 patients were included. In France, 827. In Belgium, 672. In Germany, 572. Sweden, 274. And Finland, 213. If you see this, you wonder, UK, most of the patients, but there is a but. In the United Kingdom, Aprotinin continued to be used the whole time. Remember, there was a ban of using Aprotinin worldwide, but not in the UK. And that's the reason why we have this high number in the UK. If you then look at the use of Aprotinin in the original indication, remember at the beginning I said isolated CABG. And isolated CABG, it's only 25% Aprotinin was used. The majority were other cases, 75%. And here you see now in this graph that some countries like Germany or Austria basically followed the rules to almost 100% to use Aprotinin only in isolated CABG. Other countries, and you see here Norway, Ireland, Belgium, and Sweden, and Finland, and also France and UK, mainly use Aprotinin in other indications than isolated CABG. So that is very important to understand. Here you see some demographics by age and gender. The about 20% of the patients were older than 75, and 81% were between 15 and 75. 28% were female, and again here in this slide you see in isolated CABG from 1,146, 238 were also female. In other procedures, 1,304 from 2,760 patients. If you look at this slide, the use of antiplatelet therapy in isolated CABG patients depicted, the number is 1,384, and you see in 92% of these isolated CABG cases, the use of antiplatelet therapy was reported. Missing data were around 32%. You can see here no antiplatelet therapy was 8%, 63 was a single, and 28.5 at least a dual antiplatelet therapy. If you look at the other procedures,